Good evening, classmates. This is Tina Nordeen, and here's my soap presentation for week 5. I saw a patient, AK, 73-year-old Caucasian female of Caucasian and Irish American descent. She came into the clinic presented alone, was a reliable historian to present her history, and no language interpreter was needed. Her primary language was English, and her quote-unquote chief complaint is, "I think I need some medication for depression." So Miss AK is a 73-year-old female, and she comes today feelings of depression. She is actually the primary caregiver for her husband, and they've been married for 47 years. Her husband was diagnosed with multiple sclerosis, and now she is actually his primary caregiver. He's bedbound, increasingly disabled, and requiring more and more care. She has stated that she knows that she's neglected her own health over the years, and she now has become overwhelmed and anxious, and actually has periods of anger at the situation, not at the person. She's not able to sleep, and she actually has not been eating well. Her past medical history includes arthritis and hyperlipidemia. She did have a cataract extraction in 2018. That's her only known surgical history that she could recall. And she's actually a retired, so social history, she's a retired school teacher, taught over 30 years, married to her husband for 47 years, and he was in the Army, so they have military benefits, and as well as veterans benefits. And they moved to the area to be closer to their adult children and grandchildren, live in a one-level ranch-style home with no stairs. They do own a firearm, which they keep locked, and use safety precautions with that. She does wear a seatbelt while driving, so that's some social history. I have some more social history that I will share in my soap when I submit that. As far as tobacco use, she is a current everyday smoker, and she continues to smoke and has for the last 55 years, 1 pack per day. I did attempt to provide counseling of that. She was not interested in smoking cessation. She does not have any substance abuse, recreational drug use, or alcohol use, and does drink 1 cup of coffee per morning. Her current list of medications include Lipitor, 20 milligrams, 1 time a day, and she does have a refill 11 times, so she'll be able to have her Lipitor as needed. She received the immunization of influenza, and she declined any preventative screenings at this time due to her caregiver strain and stress. As far as family history, we discussed her past family medical history. Her mother actually suffered from depression, her father with hypertension. Both are known deceased at this time. Brother had heart disease, and her sister had Hodgkin's lymphoma. As far as review of system, negative constitutional, negative for fever, chills, positive for some fatigue and weight loss, and she is having trouble sleeping. HEENT, negative for hearing losses, vision changes, congestion, rhinorrhea, no speech issues. Eyes were negative for photophobia, discharge, respiratory negative for shortness of breath, cardiovascular negative as well, GI, musculoskeletal. All of the above was negative. Looking at her neurological review of systems, negative for headache, dizziness. She is alert and oriented, and then psych part of the review of systems negative. She was stated that she had some depression and anxiety at this time. We did review her vital signs, all which were within normal limits, and I will submit those on my soap. Our physical exam was completed. I did a full physical exam with her, focusing on I focused on her neurological and mental status, as well as her psychiatric, mood and anxiety and depression. All the other systems were within normal limits. So as far as my assessment, differential diagnosis, I had 3: generalized anxiety disorder, depression, and panic disorder, and I will submit with my soap background information regarding why I chose those 3 differential diagnoses. And I landed on my chosen diagnosis as caregiver role strain. It's a condition in which Caregivers find it difficult to perform the duties that they are needing to perform. They're feeling stressed about their current situation. It could be a financial burden, more responsibility, a change in lifestyle or role, such as in this particular instance. And I provided some additional information regarding caregiver role strain. So the treatment plan for her is to treat her for depression and also for anxiety and sleep, hydroxyzine, Megace to increase her appetite, and instructed her to use protein boost or Ensure to increase her caloric intake. And then we have here in the local area an agency called the Central Savannah River area, which is where I live, and area of aging. So they provide a significant amount of senior assistance and also provide information on elderly care. And they can also help them to put them involved with the Veterans Affairs that is in the area to help with finding additional assistance in home care. I also instructed her to contact the VA where her husband is seen and contact his primary care physician so that they may receive some additional home health assistance as well for him. I went over the patient education on each of the medications, including side effects of those medications, how to take them as well. Specific follow-up will be in 6 weeks. I did not order any labs at this time. They were not warranted, nor was radiology. And the referral, as I spoke to, was to the Central Savannah River area of the aging, and provided those references on my SOAP as well. So I enjoyed listening to all of your SOAPs, and I wish you all the very, very best of luck in our last 3 weeks of this course. Thank you.